Thank you. I'm going to introduce the paper that I hope you've all seen, which was circulated, and then I'm going to ask Tamsin to take us through it, and obviously open it up for discussion. Thank you, Mike. This paper is a result of what I can only describe as an an impassioned meeting of Homes for All Cymru a few weeks ago, when the discussion was around people at homes now in the current crisis and what happens next in terms of the post-COVID recovery plan. And I think we all agreed that the pandemic has shone a revealing light on a number of areas, clearly poverty, inequality, race, but also very clearly people's homes. I guess it can be said that people's homes has been the other main narrative over this period alongside the NHS. So we've heard messages about stay at home, work at home if you can. Is your home safe and suitable for self-isolation? Is it affecting your well-being because you're unable to access an outside space? Is there room in the house for the kids to do their schooling? Is it in poor condition? Is it overcrowded? Is it actually contributing to the spread of infection? Have you even got a home? So that's been very much the other narrative. And I think it reminded us that housing is clearly our key public health asset. And I think it also reminded us about the post-war situation when health and housing were seen as the key pillars of a civilized society. So we believe at Homes for All Cymru that this is the time again for people in their homes. There will be competing demands for funding and investment as we move out of the COVID situation. We're not going to move out of it on a smooth linear way, are we? But we are putting the case that funding people's homes needs to be right at the top of the list as a part of the post-COVID recovery plan. We put this paper together. It is very much a work in progress, but we thought the place to start would be with a cross-party housing group to discuss this and how we put people in their homes front and centre of the post-COVID recovery plan. So can I ask Tamsin, would you like to just run through the paper, Tamsin, and then maybe we can open up for discussion?
Yeah. Okay, thank you, John. Yeah, and it's deliberately kind of presented in hopefully a simple and straightforward way. We didn't want loads and loads of narrative, but it's and I think one of my pleas would be, can we use the word home, not housing? So I think home has a resonance, that housing's a sort of processy thing over there. Home is what we all know and feel if we've got a good home that's so important to us, and particularly in the last 3 months. So that's something in terms of thinking about the language we use. So we start, sort of putting good homes at the core of Wales's recovery from COVID. I know there's a lot of work going on. Jeremy Miles is leading some work. I know the Future Generations Commissioner. There's just loads and loads of work going on, and it's sort of like, I suppose, trying to find some traction through that to make sure that good homes for people feature, really centrally in that conversation, because, and I think there's a number of things needed. I'll come on to that in a minute. So we started off by what do we mean by a good home? Really informed by work that all sorts of organisations represented in Homes for All Cymru have done in the past. Shelter Cymru with folk who've experienced homelessness, Tai Pau, TPAS Cymru, etc. So there's a very clear diagram about what we mean by a good home. And I suppose what COVID has the experience of living through 3 months with this pandemic has shown is there's some aspects to home, a good home, that maybe we weren't paying enough attention to. So things like digital connection, absolutely vital. I'm on a housing association board, and we know that there's a proportion of tenants who are not connected, and it makes it harder for us as an organisation, although that's not what it's about, to contact them. But also makes it much harder for those folk to get connected to the things they need to communicate with family, etc. So being connected physically, socially, and digitally is a feature of that diagram there on the second page of what makes a good home. Sufficient space and well designed. I think COVID's thrown up some really interesting challenges for design, and what no, we live in a traditional Edwardian terrace, which hasn't been knocked through. So we have separate spaces that we can do different activities, both two of us working at home, but we've still got a space that we can go into as a separate room where neither of us are working and just kind of chill out. Open plan spaces, which look, lovely and funky, probably a lot more challenging if you're working at home. Your kids might be at home. So I think there's some real issues around design. Sorry, slight digression. I understand that the new standards that are coming out of the Affordable Housing Review to replace development quality requirements, there will be a consultation happening on those relatively soon. They were written before COVID, but I think that consultation will be an opportunity for those of us that are particularly interested in and concerned about design to raise issues that have been particularly kind of shone a light on by COVID. So I think we'd keep an eye on affordability, obviously absolutely key, good condition, culturally adequate, accessible. Home needs to work for the folk that live in that home. Our needs aren't all the same, and secure and stable. We've seen massive effort gone in to get folk who are living on the streets or in really precarious housing situations into temporary accommodation. Now we need to find those folk collectively, find those folk a home that they can live their lives out in. So I think, so that's we defined, set out what we mean by a good home, identified what COVID has shown us about the importance of a good home, and I think it's that link between that's been absolutely at the top of the list is the link between public health and home. And in a sense, until it's like that phrase, isn't it? We're not all equal until everyone's equal. Well, we're not all safe until everyone's safe. If people don't have a home in which they can self-isolate, take care of their health, then public health is still at risk. And and as John said, it's back to that really clear link between health and housing that's very clear at a number of points in the last century, actually. Where the Addison Act in 1919, where the concept of public housing first emerged. So I think, but there's other issues around physical and mental well-being, the whole issue around being able to work from home, being able to homeschool children if you need to, and importantly, the ability of young people, space for kids and young people, to socialize, even if it is digitally, but connect with each other to learn and develop, and I can't imagine what it must be like to live in a one-bedroom flat with kids with no access to outside space. It must be extraordinarily challenging. I think COVID's exposed, it's everything in terms of inequality, with the housing dimension, the income dimension, the digital connection dimension, whatever dimension you look at, the health dimension, the death rate dimension. COVID has just blasted those inequalities absolutely, wide apart, really demonstrated them. It's demonstrated the inadequacy of temporary accommodation and emergency accommodation in terms of people, that's not home. For some people, home's not a safe space, whether that would be kids at home where there's physical or other abuse going on in the home, for people living with abusive or violent partners, for some people living in really, really overcrowded conditions where they can't self-isolate, where they're sharing kitchen, bathroom facilities, almost impossible to manage, to keep the hygiene levels that you might want. And also, I think a lack of investment, because we're talking about, I know there's been a lot of emphasis on new affordable, new social housing. That's super important. But most of the housing that people live in has been here for some time. So we've got, the whole private renter sector, all owner-occupied housing, across the spectrum, and we've put a strong statement in there. Housing will continue to be a public health issue until everyone in Wales has a good home. So it's a matter of life and death. We've seen disproportionate number of deaths from COVID in particular communities where poor housing is part of a nexus of challenges that they face. So it is a matter of life and death. We then said, why put good homes at the core? And there's all sorts of links there, which people will be familiar with: the health link, the economy link, the environmental link. A lot of our older housing stock, which is predominantly in the private rented sector or owner occupied, is really poor in terms of energy efficiency, expensive to heat, etc. There's with all the attendant problems around damp, mold, etc. There are. But that rectifying those issues can create jobs, it can create training opportunities, it can, with Brexit coming as well, we need to think Welsh supply chains for things. So there's a whole load of links which this group are really super familiar with in terms of why housing, should and could sit right at that core of recovery. And then just a kind of list of suggestions about what's needed to put good homes at the core. So investment, money, attention and people, a comprehensive approach that it's got to be all homes across all tenures, not just focusing on, the bits of the system where it's kind of easier because the government's got more levers maybe. And I think part of it is a change in culture around, getting away from the silo budget. So, that's the housing budget. We can't put any more in the housing budget. Investing in housing is an investment in health. It's investment in the economy. It's investment in the environment. It's investment in social infrastructure. It shouldn't be just seen as the housing budget, and we can't afford to put any more in that budget. I think we need to listen to the experiences of folk who don't have a good home, and act to address the issues that they raise, and there's been a lot of good work through the Homelessness Action Group around listening to folk that have had lived experience of homelessness, and it's really important that we not do this properly here and do something about what they're telling us. I think we have to have participation of people and communities in whatever we're doing, and this sense of a system change. It's easy two words to use, but there seem to be a lot of barriers to action and a lot of barriers to people accessing good homes. But fundamentally we need an approach that puts people first, and not, which is why I would call for using the word home, not housing. It puts people first, not process, not bureaucracy, etc. That puts people, their health and their well-being and their ability to fulfill their potential right at the centre. And then we just included a bit about joining things up. There's a lot of different activity going on at the moment, and that's an incomplete list on the last page there. But about let's try and do this in a cohesive, joined up way, rather than having lots of bits of work going on sort of separately and not really having the traction that they should. And I think we just lastly to say that we do need to, in the light of the experience of COVID and the differential impact it's had. I like the phrase I heard, because we had that at the beginning, didn't we? We're all in this together. But I preferred we're all experiencing the same storm, but we're not all in the same boat. Some people are in a nice big stable liner, and other people are kind of clinging onto a little bit of wood and hoping to survive. So I think we do need to challenge, things that are coming out of the affordable housing review, work in progress, and make sure that we have a sort of learning kind of head around the experience of COVID and what that might mean. Because certainly in terms of new standards for housing, for social housing, they will be set for the next 10, 15 years. So it's a real opportunity for us to get those kind of things right. And I suppose what we're asking for is saying, we want people, members of the Senedd to be really persistent and vocal champions for housing to be at the core of the post-COVID recovery plan in Wales, but then also, kind of what do you need from us in order to be able to do that? And this, as John said, this is very much a starting point, this paper, but we just thought really useful to get just some headlines out there to stimulate some discussion.
Thank you very much. Any questions, comments?
Mike? Sorry, this is not a question or comment. It's something I should have said right at the beginning, that we are recording this. Has anybody got any objections to recording? Because okay, that's great. Because we thought it'd be useful to record this so that those who couldn't make it today can still watch and listen to the debate. Thank you.
I think it's very useful to record it, John. Perhaps you would record all of these meetings.
I think Tamsin's little speech there used to be cut as his own little piece, I think, for why housing. I think it was brilliant.
Thank you. Any questions or comments? Well, if no one else wants to start, I'll start. I think the key is getting health and housing seen as two sides of the same piece. That too often housing is something separate, and people who, you've all heard me say it before, but I'll say it again. Is it any surprise that people living in cold, damp accommodation happen to have less good health than those living in warm, dry accommodation? And realistically, until we get the housing sorted, we're going to continue to have children and elderly people especially suffering ill health because of the accommodation, not because of anything else. Anyone else? David?
Yeah, I've been making speeches all through this Senedd session saying that housing and health should be seen as the two great, pillars of a decent society and coherence in a welfare system. And I think everyone agrees with that, but it doesn't seem to get through to changes in policy. And I think you've really got to try. I'm talking as someone who's retiring at the election, so I don't really have a dog in the race anymore. But I think you need to really try to influence the party manifestos. And there's some really hard facts that have to be grasped, like the availability and price of land, the planning system, the assessment of how many households are being formed, and how many homes we should be building. For 20 years, and it's similar in England to Wales, so both main parties are responsible, we've built at about half the historic trend. We've barely built at the third of the height of the post-war building in the late 50s and 1960s. It's quite astonishing how few homes we've been building. And it's going to take some effort to get people out of this, mode of thought. I think we should stop talking about affordable homes. It's an important concept, particularly in the private sector, because houses are just priced crazy level. But we should be talking about social homes, because that's where the main need is. And we need to be establishing some basic principles again, like you shouldn't be paying much more than between 25 and 30% of your income for housing. Now, if you're buying your house, all right, you put a capital cost on top of that, to purchase the asset over 30 years or whatever. But these are the challenges that we have today, that really those that lived between 1945 or at least the early 50s when the building really started, and about 1990 just didn't face, because they didn't have these incredible distortions. We must have one of the most distorted approaches to housing in the Western world. And I say we, of all the politicians, we're all guilty. And we all know our colleagues that want to build in general, but never anywhere in particular. And I think it's some of these things we've really, really got to tackle. In terms of investment, I mean, it is money well spent, because, you can talk about housing in terms of health and the foundation economy, building skills, providing really well-paid, what used to be called blue-collar jobs, through to highly skilled ones in terms of the new manufacturing and assembly procedures. So I would get out there and turn this excellent paper into 5 main asks that we want in each manifesto.
Matt Dix was.
Yeah, just to follow, I completely agree with the point about the link between housing and health, and that's substantially covered in the paper. I mean, the problem we obviously have, which you've alluded to, is that over half of the block grant is now allocated to health. Welsh Government Centre says that's going to be 2/3 by 2021. Given the current crisis and discussions within Welsh Government to allocate capital spending into revenue spending in the short to medium term, particularly that most of that's probably likely to go to health service, then it's a difficult sell, and totally agree with David as well around the land aspect. But I think the thing that overarches all of that is public perception, and we're not going to persuade the policymakers and government, etc., to make that strategic leap of faith, as it were, to start diverting health spending, etc., into housing and the home, unless we persuade the public of the merits of that. Now, a lot has been said about maybe the time is right within the public psyche to make that link. A lot of people have seen people suffering in terms of housing perspective through this crisis. So is a starting point of this, doing that sort of public perception and public mood setting change in order to get the public thinking about, it's not about the upfront spend on the NHS that we need to focus in on. It's about looking longer term, etc. persuading them of the merits of not putting all of our money, public spend in Wales into health, acute health services.
Anyone else?
Mike, sorry, I did want to make one further connection, and it is getting the public mood changed. We really need to be connecting with those people under 40 and under 30s, who sometimes I think feel a bit, left out of the conversation, and they're not very demanding. Now, we may be seeing changes there. Some big social changes are going on about who we commemorate in public spaces, and there's a lot of energy out there. But young people have got to realise how disadvantaged they are at the moment, how unlikely many of them are ever going to get, unless we change all this, family home. I keep reminding people, it's not people of my age, late 50s, that need a nice large family home, nice as it is to live in one if you're fortunate to have had one. It's when you're in your 30s that you need that accommodation, because you're raising a family, things being equal and on average. And, we need to get them marching on the Senedd saying, for heaven's sake, build homes for us, really get that sort of energy into the system, because it's lacking at the moment. And I think that's one of the reasons we get poor policies, because the other end is very articulate, and I don't want to quieten that voice, but the health voice, older people drawing massively on NHS services. Once you're over 50, I think you consume well over 2/3 the health you're going to have, services you're going to have in a lifetime. So we really need to start to see these things differently, I think.
Anyone else?
I'll come in if that's all right. I just wanted to pick up a couple of points based on what other people have said, and just mention something myself. So following on from something David Melding was saying about social and affordable, I think getting the terminology right is something we need to start doing a lot in the housing sector, because if we talk, a lot of the time when politicians or whoever talk about affordable housing, a lot of the public would think that means buying housing as well, whereas a lot of the time it just means social housing. So I think having a distinction in that terminology would be really helpful, especially with cut through to the public. Following on, I think it was Matt Dix that was saying this, about not putting loads of funding into, having to put a lot of funding into acute health services and kind of getting that prevention in the first place. I believe I read recently, I think it was from a Welsh Government's presentation, that every pound spent on improving the home, I think in terms of installation, saves the NHS £4. So that's something that that really speaks to the fact that housing, getting that right can be the key to unlocking problems in lots of other places. And then a bit from the paper, when we're talking about making sure that homes are affordable, that's from our perspective, that's really about lifting the income of people rather than stuff like rent controls or something like that, which are set by their market rate and things like that. And this is really important considering the discussion around coronavirus, because I'm pretty sure virtually everyone on this call has in some way made a call for lifting local housing allowance rates and things like that. So it's not just about getting good wages, which everyone obviously argues for, but it's about making sure that welfare can cover the cost of housing as well, particularly at this point. Thanks.
Anyone else? Hi, Katie.
Thanks, Mike. I just wanted to take the opportunity to reflect on some of the things that have happened over the past 3 months, because I think quite rightly the NHS and social care services have been recognised publicly and by government, and that's absolutely the right thing to do. They've done an extraordinary job, but I think a part of the workforce that hasn't necessarily got that same recognition is the homelessness, housing and support workforce, who have continued every day for the past few months to go out there, putting their own health and the health of their families at risk by going out and providing housing and support services to some of the most vulnerable people in the country, and have done so because they care deeply about their job. And you know, we many of us on this group have been shouting about the amazing work that they've been doing, but it hasn't quite got through to the public the same way that some of the other professions have. And you know, I know how hard that they've been working, whether it's staff in local authority housing options teams, or whether it's people working in RSLs or third sector homelessness organisations. People have done an extraordinary job in extraordinarily difficult circumstances, and I think it's really important to pay tribute to them. And I think that leads us on to you know, some of the thinking for the future, you know, and how we value and recognise that workforce. We know that as a result of many factors, including restrictions on public spending, that you know, public budgets have been smaller, and therefore services have not had the resources they've necessarily needed to recognise their staff in the way that they've wanted to. And certainly, you know, we would want to see those staff members recognised and appreciated going into the next Assembly term, and some real work done around the housing support grant to make sure that we're valuing and recognising those staff that I've talked about. Because there's also some, you know, some challenges to the sector going forward. I think most people welcome the phase 2 plan that the Welsh Government have set out for transforming homelessness services. That is not a short job. That will take time. It'll take investment, both in revenue and capital. And that work will start in the remainder of this financial year, and that £20 million, you know, the local authorities and their partners are currently developing plans to transform homelessness services, move away from sort of floor space and pods and into something that affords people more dignity and safety in light of COVID, in terms of having self-contained washing facilities. The Welsh Government can't commit funding beyond that. We've got an Assembly election coming up, but it's certainly something that I would like to see reflected in party manifestos going forward, that it's absolutely essential that we build enough social housing to meet the needs of the population. But for some people, simply a roof over your head isn't enough, and that support is incredibly important. You'll know, of course, that the Housing Support Grant provides the majority of the funding for homelessness and housing support services. We have a guarantee until this Assembly term that that continues to be ring-fenced, and that's certainly something, you know, we've had cross-party support for this, and we would hope to see that reflected in party manifestos, and that commitment to keeping that ring fence into the next Assembly term, and to see that funding increase. But reflecting back on the housing and health partnership there, I think increasingly what we'd like to see is multidisciplinary teams that support people who are experiencing homelessness. We've got one in Cardiff that's worked really well over the past couple of years, where there's been mental health and substance misuse workers working alongside the homelessness outreach team. They've been able to understand people's issues, get to the root causes, provide people with the support that they need, whether that be for mental health, substances or other issues. And that's certainly a direction of travel that we'd like to see, with health firmly at the table when it comes to ending homelessness, offering resources and expertise to help make sure that homelessness is only ever kind of rare, brief and non-recurrent. So that's just some thoughts I have on, you know, I think it's important to reflect on some of the incredible work over the past 3 months that's taken place, often, you know, out of the spotlight, but also to think about how we value those services and value that staff as we move forward into party manifestos and into the next Assembly term. Thank you, Mike.
Two people have made comments, Tim and Hayley, on the chat. Do you want to? Do you have to make those comments to be recorded? Oh.
Yeah, I was just saying maybe we could use our social media platforms to shout about what a house should look like. Sorry, what a home should look like, and the great work that the housing services are doing, because we've got such a great voice collectively. I think it should be put to use.
John, you want to come in?
I just want to, well, it's really partly following up Hayley's point there. I mean, what we've heard, I just wanted to think through about how we take this forward, this idea about putting a home, people's homes, front and centre of the post-COVID recovery plan. Two proposals. One, David said about party manifestos. Matt talked about maybe changing the public perceptions of housing. And just the latter one first. I've been doing this campaigning business for nearly 40 years now. So one of the issues I think has always been trying to break through with the public in terms of them understanding the way that housing has such an impact on everyone in one way or another. And people tend to think, the majority of people tend to think, look, my housing situation is okay, what's the problem? And all the arguments about, well, there's a health issue. I think one of the things that this is exposed, and Tamsin said it earlier, is that, as Tamsin said, we're not safe until we're all safe. And what this is exposed is the fact that everybody needs to be protected, everybody needs to be in suitable homes, otherwise everybody is at risk. And I think that's the potential way of changing the public narrative. And one of the questions I have for all my colleagues here on the screen is, should we, and I'm probably following up Hayley's thing, should we come together and put out some very key messages, maybe based on this paper and using some of the images of the paper, collectively, so we're getting out there to the public with a very similar set of messages and voices. And also, in terms of the manifesto, whether colleagues feel that we all go to the political parties with our own particular list of what we want to see them include, but whether we could all start with something like this paper, or this paper as an entry point, followed up by our own particular request, but we start with this approach about the importance of a home over everything else here, and then we can follow up with our own particular ask. I'm just interested in some views on that.
Mike, I was just extending on Callum's point really, and I've just provided the link to the report he was referring to. I believe it was written by the BRE and Public Health Wales, and it just basically shows the synergy between investing in housing conditions and improved health outcomes. So as Callum says, there's one statistic in there. I've forgotten what it was now. Was it every pound put in terms of insulation, in terms of improving the warmth of the home, the NHS actually saves £4. So, you know, this is about saving money on the Welsh NHS as well. And it's also got to be stated as well, this report was actually written before COVID-19 as well. So I think it's even more important now with this pandemic in place as well.
Thank you. Jenny?
Thank you, Mike. I would 100% echo the points that John made about collective action, about changing public perceptions, and also looking at manifestos. I think what I wanted to emphasise also in this is about the need for urgency. During lockdown as well as post-lockdown, our casework has become really critical in some local authorities now around homelessness. We're seeing very vulnerable people who are being kept in a rough sleeping situation because there's no temporary accommodation for them. We are seeing, my colleagues are telling me that they've never seen kind of such widespread issues from a legal perspective, in terms of people's homelessness rights not being honoured, as we're seeing now. So it's about what can we do now as well as what we can do for 2021 for the manifestos. Certainly around homelessness, I think that's the absolute sharp end that we're seeing at the moment.
Thank you. Can I welcome Mark, if you would, who did say he was going to be late. So welcome, Mark. And Di Lloyd has sent his apologies. Anybody else want to make a comment?
Yeah, Mike, if it's okay to come in. I'm just sort of reflecting on the housing health kind of interface, which we all kind of intellectually know, and also reflecting on I suppose both the election, sorry, this is a bit of a random set of thoughts coming through now, the election of Trump in America and the Brexit campaign, where you had one side stuck lots of facts into the mix, and one side, this is very crude analysis, the other side went for an emotional connection. And I'm a researcher, so I would always go the facts route, but I'm not sure the facts route, when it gets us, I have to, this is like heresy to say as a researcher, but I think sometimes the facts route doesn't necessarily get us where we want to be. And I do think in the terms of the experience of the last 3 months, the emotional connection with home, it's been heightened for people. And I think that's where, what John Pusey was just saying about how we might, we're not all safe, and we're not safe until everyone's safe. But maybe that's something that we can build on in an immediate way. And yes, have the facts and the research base and everything, because that's more in a sense of coming around to constructing budgets and programs and all the rest of it. But I think I'm not sure facts for a public health, you know, to front a public awareness or a campaign that's trying to shift hearts and minds is actually, and I say it feels like heresy to say so, but I do feel something more emotional, with an emotional connection to folk might be the way to go on the public side of things.
Oh, thanks, Mike. I'm really glad following Tamsin just saying that, because I'm going to partially agree on the facts thing, but sort of throw something else into the mix as well, which is it's on the back of the work that Crisis commissioned a couple of years ago on the framing of homelessness communication. And I guess the background to it really was trying to look at what are the ways that we as a sector and as politicians and those who are kind of working in this field, what are the ways that we can talk about these things in a way that's going to really resonate with the public, about what the nature of the challenges and what the solutions are, and what are those things that are really going to effectively show that. And so the research is all about those kind of, I guess, the stories that we tell around the facts. So those kind of frames that we put around the facts that we're describing, and the kind of the ways that we do it. And the research we did, it found there's three frames in particular, so 3 ways of talking about this that are particularly effective, that I think we can make a lot more use of in our communication in the way that we've been talking about. So one is the idea of constant pressure. So it's this idea that people, everyone experiences pressure, particularly I think at the moment with the coronavirus outbreak, everyone's experiencing pressure of some sort. But the idea that some people experience more pressure than others, and that, in the way that Jenny was just describing, there's many people who are experiencing like particularly severe pressures on top of all the things that they were already experiencing before the outbreak. And the research found that talking about that in the way, almost like a dam with the sort of water building up behind it, is a way that really helps the public understand the importance of prevention, and either through strengthening the protections and strengthening that dam, or reducing the pressure behind it. And kind of using that as a way to describe what needs to happen. And I think the other 2 things that came out really strongly, which John actually alluded to just now, was the 2 kind of values, if you like, that really seem to resonate with the UK public around housing. The ideas of the moral human right to housing. So it's not quite the same thing as the legal right that we've been talking about in recent months and years, but it's that idea that it's just a basic need that we all have, and the idea that some people don't have that, and that's just not right, that idea, and that really kind of resonated with people. And the other thing that resonated with people is that idea of, again, John just mentioned it, the idea of interconnectedness. And I think people have really seen that during the outbreak, the idea that the actions that you take in your day-to-day life can affect broader society, and that was an idea that people really resonated with people on housing, that idea that because some people don't have housing, it sort of harms us all in some way. And so it's definitely sort of that foundation and that frame. And that's where I disagree ever so slightly with Tamsin, that I think the facts are still important, but that they should sit within those narratives, the idea of the constant pressure that people are under, the idea of like housing as or homes as a kind of a moral thing that we all need to make sure everyone has. And that idea of the interconnectedness, so that we're all affected by this, and it's not something that happens to other people, it's something that affects us all.
Bethan?
Thanks, Mike. We at CHC welcome the paper. The points around sort of cultural change, listening to tenants and those who've experienced homelessness as well, I think are really important, as well as the points around sort of participation. Tim mentioned the report. CHC were part of that report as well, and it shows that cold housing costs the Welsh NHS £97 million per year. Mike is also right that housing's not only causing poor health, but we're also seeing 3,000 excess winter deaths a year, which is 30% of attributed to people living in cold housing. Health and housing is so intrinsically linked. I think we need to increase funding from Welsh Government to match the ambition of reaching EPC Band-Aid by 2030, as well as sort of building new zero carbon homes, as well as retrofitting. We know that the decarb programme will have such a positive impact on the foundation economy as well, things like skills, jobs, health, fuel poverty. It's so much more value than just building homes. And just lastly, linked to Hayley's point, we launched our With You campaign, which raises awareness of the support offered by housing associations to tenants who are facing difficulties during this period. And we worked closely with WLGA and local authorities on this, and we produced a financial assistance protocol, which I'll see if I can put that in the chat box. And the protocol basically sets out the types of support that tenants of housing associations and local authorities can expect throughout this period, and it includes a strong commitment from housing associations to work closely with partners in local authorities and the third sector to ensure that we receive the appropriate support for their situation. So I'll see if I can share that. Thank you.
Anyone else? Amy, is that an agreement, or now do you want to speak?
Yeah, if I could, Mike. Just to have a little look at the chat box, I think it's Tamsin saying we need short-term and long-term action, and that's something that I really agree with, actually. Obviously, we need more social housing, but that's going to take a reasonable amount of time, isn't it? So in the short term, I think we need schemes that can utilise all tenures, including the PRS. And one thing we discussed previously was the pilot scheme for the Welsh Government social leasing scheme. And one thing that we're looking at, really, or we think would be a good idea, would be to, rather than go for the pathfinding stage, would be to utilise a scheme pan Wales, across Wales. So basically this scheme is where local authorities or RSLs manage PRS properties on behalf of landlords for a 5-year period. And in return, landlords get a guaranteed rent at LHA level. They can get guarantees that they'll get wraparound support and any costs incurred for damages as well. So this could be a really useful scheme across Wales, and we have had discussions with a number of local authorities on specific packages of support we could highlight to our members as well.
Thank you, Alicia, and then Matt.
Thank you, Chair. Yeah, just to reflect on some of the points that were made, I wholeheartedly agree that we should all sort of get together and bring in a public perception campaign, because public perception is probably the most important thing out that influences policy and politics, really. And I think that the key thing that COVID-19 really did is change everyone's perception of a house as a commodity. I think a lot of people kind of think about it like that, and it basically changed our perception of it, and a lot of people will see it as a necessity now. I think quite often people will think that people in precarious housing situations, that expensive housing, lack of housing is just what it is, and we should just suck it up and nothing can be done about it. But what the previous 3-4 months have shown is that we can, and it's about not wasting that energy and kind of building on it. And I think everyone in those last 3 months kind of could imagine, what would happen if I didn't have a home? What would I do? Yeah, I'd support the public campaign. I think what Nick said as well around public support for the idea of housing as a right, as a necessity. I think we should just build on it. Yeah.
Matt.
Thanks, Mike. Just sort of building on what the last couple of speakers are saying. So yeah, I think this is
following up on a couple of the comments. Firstly, about Bethan, about fuel poverty. Just so you know, this afternoon I'm meeting online Ben Saltmarsh, who's been appointed as the director of NEA Cymru, ahead of an online meeting of the cross-party group on fuel poverty and energy efficiency on the 23rd of July. And obviously COVID related issues and housing was key, obviously, on the agenda. I had a online meeting yesterday with Cala about off-gas areas, for example, in this context. So it might be worth, in that context, joining up or doing a bit of joint work, or at least some of you perhaps choosing to attend our online meeting on the 23rd and having input into that and liaise with Ben if you wish to. The reference, I think, was it Tim was making reference to schemes whereby, I think it was RSLs could take on management of stop for 5 years and what have you. Similar schemes have come around in the past, and it takes me back a decade to when this group and its predecessor formats were discussing things like social letting agencies. As we saw a growth in private rented sector access agencies, which enabled local authorities to access a wider range of housing for people in need of housing, but it missed that support element that was included in the social letting agency model, which was designed for the inverted commas hardest to house. And initially, at least, the research feedback that we looked at a decade ago was encouraging. So my thought is how we could incorporate the model that Tim was describing with housing related support for people who have been street homeless, people who have got comorbid conditions or complex needs, to enable their tenancies to be sustainable and to give reassurance to the landlords that everything will be as it should be. Two more brief thoughts. I've had some representations made to me under lockdown and under the revised planning guidance that's gone to local authorities, that those authorities, particularly those who still haven't got local development plans, are using or are able to use the repositioned scrutiny processes to look at planning applications which may be more speculative, or putting through the LDPs quickly without necessarily the scrutiny they need to ensure it meets local housing needs. And I'm getting quite a lot of representation both from councillors but also from members of the public concerned about that, where of course we need to ensure it's not just the supply, which is critical, but it's ensuring the supply meets all the needs. And interestingly, this week I got a message from a group in Conwy who'd been objecting to a planning application which had been essentially speculative, which has now been replaced with a revised planning application designed with a housing association that's exclusively social rent, intermediate rent, or low cost of ownership. And it's going to have to go through the whole planning process again. But different areas, different issues are arising, but the key issue is how we ensure that at a local level, planning decisions, as well as meeting the general planning policy Wales 10 requirements, are reflecting the real need on the ground. My final thought is just some of the feedback I've been getting from local authorities has been that in providing emergencies of housing during lockdown for rough sleepers, some people, a small minority, were still refused the shelter they've been offered. So we mustn't forget the need to engage with those people on their obviously very complex needs. But more broadly, we know that a lot of work was going ahead on supporting people coming out of rough sleeping into emergency provision or intermediate housing, but embedding the long-term housing-related support they need to prevent the revolving door as we go forward. I'll shut up at that point.
Thank you, Mark. Matt?
Thanks, Mike, and thanks, Mark, for those thoughts. I think, yeah, there's a bit an element here of the short sort of medium and longer term stuff around, you know, policy schemes and where budgets need to be reallocated. But I suppose this paper fundamentally is talking about how we agitate a paradigm shift in the way the public and politicians perceive the home. And from that perspective, it was interesting in Nick's thoughts on the moral right, which I think is absolutely right. Although I would caveat by saying that the nation is agreed that there's a moral right to healthcare free at the point of delivery, for example. But that took legislation to enact in terms of setting up the NHS. So my thought on that would be that, you know, we would need to legislate to incorporate the full right to adequate housing, fundamentally as a starting point of any campaign to change the perceptions of public and therefore politicians. So presumably we would agree as a group that needs to play a fundamental central role in any campaign, and try and get all political parties to publicly state that would be their intention ahead of the next Assembly elections, particularly as in light of what's happened with COVID and the impact of home. So I was wondering what people's thoughts on that would be. And just one last point, interesting point that Tamsin raised about the dichotomy in two groups of people in our communities now, looking at fact and looking at values and feelings as a way of promoting policy change. And just wondering how we would tap into that and what the messaging would need to be.
Okay. Anyone else? Oh, yeah, Tamsin.
Yeah, I think I was probably overstating the sort of emotion over fact. I think, as Nick said, it's a more nuanced thing, but I think you've got to have messaging that kind of works for. I mean, it's, you know, there's more than two sets of brains, but there are, you know, folk who really respond to factual, objective stuff, messages, and there's those that respond to more you know, more heart rather than head. So I think we have to be mindful of both ways in which people, well, and there's probably more than two, but those ways that people might receive information. I mean, in terms of you saying, Matt, that you'd have to legislate before you start a campaign, I'm not sure if that's what you actually meant, but I think the two things, because actually, you know, legislation can be stimulated by a public demand for something to happen. So I think the two things can go parallel. You can be looking at the political part of that in terms of getting a commitment to legislate for a right to adequate housing into manifestos, whilst also doing work with the public in terms of acknowledging our emotional attachment to home and the need for that we've all felt, you know, that those of us lucky enough to have a good home have felt, and linking that with that should be available for everyone. So I think you can probably do them in parallel rather than stuff having to be kind of sequential, because otherwise feels like there'd be a long gap, because legislation takes, as we know, legislation can take a while to hatch, even once there is a commitment to it. So it's that, and I'm just really reflecting on the urgency point that a number of people have brought up. And I know there's the phase 2 plan and the 20 million, and I guess part, you know, as Katie said in the chat, part of that is just making sure that has as much traction as it. I mean, it's extraordinarily challenging to, I know it's a combination of capital and revenue, it's extraordinarily challenging to try and do a lot with that in terms of additional homes, apart from buy, you know, if it's available to buy stuff on the open market or from stalled building sites or whatever. So again, I think it's dragging some of those things we've done in the past and thinking creatively about how some, which might also give people more choice about where they can live as well, moving out of temporary accommodation, which would be, and people have heard me say that before, would be a great thing. But I think if there's it kind of feels like we need, you know, are there legal things that need to happen? You know, Shelter have got that hugely rich kind of data from the advice, you know, huge numbers of people that they're providing advice to, you know, and Camorra through its members, you know, there's a lot of richness of experience that we've had. So it's, you know, so what needs to happen kind of around the evictions issue, for instance, you know, we've fended off one cliff edge, but we now got a different cliff edge. You know, do we just try and shunt that cliff edge forward, or we do something more intelligent about that? I haven't got a legal brain, so I haven't got any bright ideas on that, but I think it's almost kind of like just a list of bullet points of things in terms of, yeah, whether it's legislative, you know, ministerial direction, policy stuff, etc., that comes from the rich information we've collectively got from the last 3 months. And our history of knowing, you know, what's worked in the past, what hasn't, you know, all that stuff. So there's a bit of distilling needed, I think.
David?
Yeah, I'm attracted to stating that housing is a right, because unfortunately we've got to a position where that's not, you know, front and foremost. Though if you say the opposite, people don't have a right to housing, it does sound a pretty brutal, extreme and uncivilized statement, but yeah, you know, I'll let that pass. There are two types of legislation and they can be combined. The declaratory bit, I suspect you get most parties to agree to that, so that we make some sort of legal statement saying there's a right to housing. But what's really important is the actionable or justicable, I think is the legal term, bits. So that's more challenging, but that's really what is needed, even if it can't come on stream for, you know, 5 or 10 years when you think the general housing situation could have improved so people can take a local authority, or indeed the UK government, whoever sets welfare then, to court, saying that the local planning is not providing enough homes for social use or whatever, or that the UK government could be taken to the Supreme Court saying that it set HLA at such a low percentile that in effect it means many people are excluded from decent housing. And the Supreme Court could strike down a policy saying this is not compatible with the Act and needs to be rethought. Unless you have that sort of bite, they're kind of, fluffy, nice declarations which no one could really disagree with, but they don't have any, leverage on what a government may or may not do. And I think I think we should be pushing for this sort of thing because, we would think it's actually outrageous if we said that certain parts of the population should be excluded from certain treatment in the NHS because some form of social criteria you come up with, or that their income level is such or whatever.
Alicia?
Thank you, Mike. Yeah, I think quite a lot of people out there are unfortunately excluded from the NHS treatment on immigration grounds, but that's a different point. Yeah, I think what just to reflect on the points that you made, David, Matt and Tamsin, I think that the key thing is there not to say legislating for right to housing, and we've been campaigning on this together with Shelter and CIH Cymru for a while now. Not to see it as a kind of end result of a long campaign or a series of actions and waiting until we have enough of, enough houses or enough money or enough interest in this to legislate. It should be kind of the overarching, according to me, in my view, the overarching ask and something that we should be pushing for as soon as possible. It's not an end result. It is something that will drive the asks that we're all making in this paper.
Okay, John?
Thanks, Mike. I'm just sort of aware we might be coming to the end of the meeting. I just wanted to think about a few next steps from the conversations that have happened. One of the asks in the paper is whether members of the Senedd will be happy to be a persistent and vocal champion for housing in the Senedd. Well, we know that the members of the Senedd attending this meeting are champions for housing. So one of the things I'm suggesting is that perhaps we have very soon another Homes for All Cymru meeting where we design a Senedd-facing campaign based on this paper to try and bring in other AMs, into that group of housing champions, homes champions, and maybe also we can use the Homes for All Cymru platform to come together and design a public-facing campaign. Let's put aside our own particular asks and wants, but something based on this together. So I'm just suggesting that maybe Homes for All Cymru might be a good platform to design both those kind of approaches, both those kind of campaigns.
Everybody happy with that? Oh, sorry, Tamsin.
Yeah, I was just thinking, based on Katie's first contribution, I'm wondering whether this paper was put together quite quickly, but whether we could add another, it's a living document, isn't it? Whether we could add another section to it, which highlights the work that's been done during COVID, and I think that would fit in quite nicely with what the paper's trying to say. That this is what a good home is, this is what COVID's exposed, this is what we've been able to achieve in the short term, but actually for the longer term we need these things to happen. So if people would be happy for me and Katie to just put, and it might be another diagram or a little table or something, or just a couple of paragraphs of text, just to note that immense amount of activity and what it's achieved, when it's almost like you put the focus on what can we achieve when we put that clear focus on it, and it had the what we're calling for later, it had people at the center of it, people and their safety and their you know, needs in terms of shelter and support at the safety of it. So if that's something, and we could do that pretty quickly, and then it could go back round the, sorry Michelle, the translation and design loop within Shelter Cymru. But I think it might make the it might strengthen the paper, I think.
A lot of people nodding. Okay. Are we agreed with that as the way forward? Yeah. Somebody's chatting to me. Mark Harris, do you want to come in? No. Nope. Anyone else, or are we happy with this as the way forward? Yeah.
John, just wondering what kind of timescale you were thinking for Homes for All Cymru meeting.
This afternoon? No, I'm joking.
All right. I'm zoomed out. I'm zoomed out.
No. I'm just picking up on the sense of urgency that everyone has. So I need to talk to colleagues and how we do that. But I would like as soon as possible. Basically, I can see Michelle collapsing the heap there, but well, obviously we also need to maximise attendance, so we'll try and get it fairly soon. Yeah, next couple of weeks.
Yep.
Okay, well, I'll just end on a couple of comments. That issues do shoot up the political agenda. If you went back to the 2005 general election, Europe was a minor issue which got very little traction amongst the public. By 2015 and 2017 and 2019, it was the major issue. You can make, if you want to make things a major issue, you have to get the public talking about it. And I think Tamsin's right, it's got to be, at least in part, people feel that something is wrong and that they don't like it. And then they want to do something. I think that really is appealing to people who don't listen to lots of data, but feel that it's not right that that woman over there and those two children are and have got nowhere to live. That appeals to people's emotions. If you can make that appeal, or that man who just left home and then ended up in temporary accommodation is now sleeping on the streets. These sort of things that appeal to people's emotion, that people are being badly treated, will have a much better effect than all the lists of people. And if I can just give an example, we talked about immigration, we talked about it, and the only thing that really hit home with the public was when that little girl died and the picture was on in the papers, and all of a sudden people who wanted to come to this country weren't these immigrants, they were real people, and some of them were losing their lives, and it really did hit home to the public. You've got to have an emotional attachment. Okay, right, Sean.
I just wanted to come in quickly on that. I'm here on behalf of Helen Mary Jones. I'm at the Senedd, and I just wanted to pick up on the importance of coordinated campaign. I just thought then about what we've seen in England this week with the whole feeding school children campaign, and obviously that was likely to gain a lot of attention due to who was sort of leading it. But you did really see the emotional connection that people who weren't aware of it initially sort of picked up and thought, oh, this isn't right. And obviously, I think that just shows the power of it, really.
Yeah. Anyone else? Oh, as far as I'm aware, there's no other items on the agenda unless John tells me anything different. So can I thank everybody for attending, and I'll close the meeting. So thank you all very much.
Thank you, Mike. Thanks, everybody.
Thank you.